Okay. Oh, I have one oh, hello. As we've been doing in our tradition, every Friday we welcome in someone who can't be here physically with us in the briefing room. So this is Natasha Lindstrom of the Pittsburgh Tribune Review. And I understand, not to embarrass you, Natasha, but today's your birthday. Is today your birthday? Oh, we can't hear you. Uh-oh.
I got it. Sorry. It is my birthday today, so it's a neat opportunity to be here. Thank you for having me.
Well, happy birthday. Thanks for spending a few minutes with us here today. So how can we help you? Or what questions do you have for me? I was going to say to the press corps, but that's not actually how this works. But go ahead. That would be great.
So the pandemic shined a spotlight on many long-standing problems plaguing nursing homes across Western Pennsylvania and nationwide, including facilities that have gone understaffed and demonstrate a history of poor infection control and ineffective management long before COVID. There's also been the trend of historically poor performing operators owned by complex webs of private equity investors and shell companies, increasingly snapping up cash-strapped facilities across our state and around the country. The setup can make it hard to figure out who's in charge and where the money's going. It also can allow owners to shirk accountability should anything go wrong. And it makes it tough to follow the money, even though the majority of the budgets are federal taxpayer dollars via Medicare and Medicaid payments. Legislation in various forms to improve nursing home quality and transparency has bipartisan support, including bills put out by the likes of Pennsylvania Senators Bob Casey and Pat Toomey, but much of it has stalled for years. Now, during the pandemic, we have seen an increase in scrutiny by the likes of HHS and CMS. In one of the more egregious cases, a federal grand jury investigation is underway linked to some of the operators here in Allegheny and Beaver counties in our region. Can you elaborate on what concrete actions are being taken or will be taken moving forward on regulatory, legislative, investigative, or other fronts to ensure accountability and transparency in the long-term care sector? How can we make sure the federal government, states, and owner-operators are all doing what they should be doing to improve the level of care, even beyond COVID?
Great. Well, thank you, Natasha. And I think there's no question that from the president's standpoint, that the impact on seniors, what we've seen happen in facilities around the country, especially in the early days of the pandemic, when there clearly weren't the preparations in place, when there weren't the systems in place, when loved ones couldn't even engage with or reach their members who were staying in these senior care facilities, it exposed what a problem we have on our hands. As you noted, there's legislation that's in Congress, and certainly we will look forward to taking a look at that more closely. And I expect, as we are getting to the stage where the pandemic is hopefully under control, that's our objective in the coming months, that we will all take a look at and reflect on what changes should be made for the future to be better prepared, to take better care of our seniors, to take better care of our communities in the future. In terms of regulatory actions, I'm not in a position to get ahead of that. I'm happy to see if there's anything underway that we would be able to speak to from here. But I think you have clearly identified a challenging issue that's not only a problem in Pittsburgh and in Western Pennsylvania and parts of Pennsylvania, but we're seeing in states across the country as well.
There's a lot of blame game gets thrown around. You know, that the states blames owner operators say they don't have enough resources. The feds blame the state. Whose responsibility is it to really make sure meaningful change happens, even beyond the pandemic? Because a lot of these problems that were exacerbated by the pandemic, but have existed for many years, especially with the lack of transparency element.
You're right. I mean, it's really both. It's not just one or the other. I mean, there are responsibilities that the state has because there's certain funding that goes to the state to deploy in a lot of these areas. But there's also responsibilities of the federal government to look across at different states and see these challenges that are happening, what we can do better by our seniors, what we can do better for the standard of care in these caregiving facilities. I think it's really a partnership in both moving forward. Well, thank you so much. Happy birthday. I hope you have a wonderful celebration this weekend, and thanks again for joining us. Great. Well, thank you, everyone. As I promised yesterday, I promised snacks. I did not bring them in here, but my mother-in-law made homemade chocolate chip cookies for you guys. So there's one for each of you in here. We will do it in a COVID-safe way. But thanks, everyone, and have a great weekend.